Most people don't think about their balance until something goes wrong. A small stumble, a moment of instability, or a fall that seems to come out of nowhere. But here's what's important to understand. Balance doesn't suddenly disappear overnight. It declines gradually, often without obvious warning signs, until one day, your body simply can't respond the way it used to. In fact, research has shown that balance and stability are closely linked to overall health and longevity, especially after the age of 60. Studies have found that simple balance tests can be strong indicators of strength, coordination, and even long-term mobility. And yet, most people never test their balance at all. On this channel, I share simple, practical health guidance to help you stay strong, independent, and confident as you age. Today, we're going to do something a little different. We're not just talking about your health, we're going to test it. In this video, I'll guide you through a few simple balance tests you can safely try at home. These tests are quick, easy, and can give you a clear idea of how your body is functioning, often revealing things you may not have noticed. And before we begin, if you find this kind of content helpful, make sure to subscribe. This channel is here to give you clear, practical guidance so you can take better care of your health as you age. Also, let me know in the comments where you're watching from. It's always great to see people from different places coming together to focus on their health. Now, let's begin with the first test. And this one may be more revealing than you expect. Let's begin with a test that may seem very simple, but is actually quite revealing. Standing on one leg. Now, before you try this, make sure you are in a safe environment. Stand near a wall, a chair, or a countertop, something you can hold on to if needed. Safety always comes first. Once you're ready, stand upright and gently lift one foot off the ground. Try to hold that position. Now here's what we're looking for. Can you maintain your balance for at least 10 seconds without holding on to anything? If you can, that's a good sign. If you can hold for 20 seconds or more, that's even better. But if you find yourself wobbling, needing support, or putting your foot down quickly, your body may be telling you something important. This test works because balance is not controlled by just one system in your body. It's actually a combination of several things working together. Your muscles, your joints, your inner ear, your vision, and your nervous system all play a role. When you stand on one leg, all of these systems are forced to work together to keep you stable. If one part is not functioning as well as it should, your balance becomes less steady. Now, as we age, it's normal for some of these systems to become less efficient. Muscle strength can decrease. Reaction time may slow slightly. And the inner ear, which helps control balance, may not respond as quickly as it once did. But here's the important part. This decline is often gradual. You may not notice it during everyday movements, but when you challenge your body, like in this test, the differences become more visible. Another factor to consider is confidence. Sometimes, the issue is not just physical, it's also how secure you feel. If you hesitate, tense up, or feel unsure, your balance can be affected. That's because your body becomes less relaxed, and small adjustments become harder to make. Now, if you struggled with this test, don't be discouraged. This is not about passing or failing. It's about awareness. Your body is simply showing you where it needs support. The good news is that balance can be improved. Simple exercises, such as practicing standing on one leg while holding onto a support, can help strengthen the muscles involved. Over time, as your strength and confidence improve, your stability often improves as well. You can also try this test on both sides. Sometimes, one leg may feel stronger or more stable than the other. That difference can also be helpful information. The key takeaway here is this. Balance is not just about avoiding falls. It reflects how well your body is functioning as a whole. And a simple test like this can give you valuable insight into your strength, coordination, and control. So take a moment, try the test carefully, and pay attention to how your body responds. Because small signals like this can tell you a lot about your overall health. Heel-to-toe walk. Now let's move on to the second test, and this one focuses on coordination as well as balance. It's called the heel-to-toe walk. You may have seen something similar before. To begin, stand upright and take a step forward. But instead of walking normally, place the heel of one foot directly in front of the toes of the other foot. Then repeat, heel to toe, heel to toe. Try to walk in a straight line for about 10 steps. Now, as you do this, notice how your body responds. Do you feel steady and in control? Or do you find yourself stepping off balance, widening your stance, or needing to stop? This test is important because it challenges your body in a different way than standing still. It requires coordination, timing, and control of movement. Your brain and body must communicate quickly and accurately to maintain stability as you move. And this is where changes can begin to appear. As we age, coordination can become slightly less precise, not dramatically, but enough to affect movements that require fine control, like this one. You may notice that your steps are not as aligned as you expected, or that your body sways slightly from side to side. In some cases, people may feel unsure or hesitant while performing this test. Now, this doesn't necessarily mean something is seriously wrong, but it can be an early sign that your balance system is not as strong as it could be. Another thing this test can reveal is how well your body adjusts to movement. Balance is not just about staying still, it's about staying stable while in motion. And that's what this test highlights. It also relates closely to everyday activities. Walking through a narrow space, turning quickly, or navigating uneven surfaces all require similar coordination. If this movement feels difficult here, it may also be more challenging in daily life. Now, as with the first test, the goal is not perfection, it's awareness. If you notice instability, that simply means your body may benefit from strengthening exercises. Practicing this movement slowly, near a wall or support, can help improve coordination over time. You can also start with fewer steps and gradually increase as you feel more comfortable. Another helpful tip is to focus your eyes on a fixed point ahead of you. This can help your body maintain better alignment and stability. And don't rush. Move slowly and with control. The slower you go, the more your body learns. The key message here is this: balance is not just about standing still. It's about how well your body moves with control and coordination. And this simple heel-to-toe test can reveal a lot about how your system is functioning. So take your time, try it carefully, and observe how your body responds. Because small challenges like this can provide valuable insight and help you stay steady, confident, and independent as you move through your day. Sit to stand without using your hands. Now let's move on to the third test, and this one focuses on strength, control, and stability all at once. It may sound simple, but it can reveal a lot about your body. The test is this: can you sit down and stand back up from a chair without using your hands? To begin, sit in a stable chair with your feet flat on the floor. Make sure the chair is not too low and that you're in a safe position. When you're ready, cross your arms over your chest, or keep your hands off the chair, and try to stand up using only your legs. Then, slowly sit back down in a controlled way. Now, pay attention to what happens. Are you able to stand up smoothly? Or do you find yourself leaning forward heavily, struggling, or needing to use your hands for support? This test is important because it reflects lower body strength, especially in your thighs, hips, and core. These muscles play a major role in keeping you stable during everyday movements. Standing up from a chair may seem like a routine action, but it requires coordination, balance, and strength working together. As we age, muscle strength naturally decreases if it's not actively maintained. This can make movements like standing, climbing stairs, or getting out of bed more challenging over time. But here's the key point. Difficulty with this movement is not just about strength. It's also about control. If you drop quickly into the chair instead of sitting down slowly, that may indicate reduced muscle control or balance. And that's important to notice, because controlled movement helps prevent falls and injuries. Another thing this test reveals is confidence in your body. If you hesitate or feel unsure, your movement may become less stable. Now, if you were not able to complete this test without using your hands, don't be discouraged. This is very common, and it's something that can improve with practice. Simple exercises, such as repeatedly standing up and sitting down with support, can help strengthen the muscles involved. Over time, as your strength improves, you may find that the movement becomes easier and more controlled. You can also start by using your hands lightly for support and gradually reduce that support as you build strength. The goal is progress, not perfection. It's also helpful to pay attention to your posture. Keeping your back straight and your feet positioned properly can make a difference in how stable you feel. The key takeaway here is this: your ability to move from sitting to standing is a strong indicator of your overall mobility and independence. It reflects how well your body can support you in everyday life. And a simple test like this can give you valuable insight into your strength, balance, and control. So take your time, try it safely, and observe how your body responds. Because understanding your body is the first step toward keeping it strong and capable. Turn and stop balance test. Now let's move on to the fourth and final test, and this one focuses on how your body handles sudden movement and changes in direction. This is something we don't always think about, but it plays a major role in preventing falls. The test is simple. Stand upright in a comfortable position. When you're ready, take a few steps forward, then turn around and come to a complete stop. Now, as you do this, pay close attention to your body. Do you feel steady when you turn? Are you able to stop smoothly and remain balanced? Or do you feel slightly unsteady, needing to take extra steps to regain your balance? This test is important because many falls happen not while standing still, but during movement. Turning, changing direction, or stopping suddenly requires your body to adjust quickly. Your muscles, joints, and balance system must respond in a coordinated way. And as we age, that response time can become slightly slower. You may not notice it during everyday activities, but when you perform a movement like this, the difference can become more noticeable. Another factor involved here is your inner ear. This part of your body plays a key role in balance and orientation. When you turn, your inner ear helps your brain understand your position and movement. If that system is not responding as efficiently, you may feel slightly dizzy or off balance during or after the turn. Vision also plays a role. Your eyes help guide your movement and maintain stability. If your visual focus shifts quickly, your balance may be affected. Now, if you felt unsteady during this test, that's important information. It doesn't mean something is seriously wrong, but it does suggest that your balance system may need support. The good news is that this type of balance can be improved. Practicing controlled movements, such as slow turns and stops, can help your body adapt and respond more effectively over time. You can also perform this test slowly at first, near a wall or support, and gradually build confidence. Another helpful tip is to focus on a stable point as you turn. This can help your body maintain better control. And always move at a pace that feels safe. There's no need to rush. The key message here is this: balance is not just about standing still. It's about how well your body responds to movement, change, and direction. And this test gives you a clear picture of how your system is working in real-life situations. So take a moment, try it carefully, and observe how your body responds. Because these small insights can help you stay steady, confident, and in control of your movements, which is essential for maintaining independence as you age.